Hi, I'm Dr. Andrew D. Bethune at Brown Chiropractic right here in Yarmouth, Maine, and you're here because you've got low back pain. So, low back pain is one of the most common things that we treat here, and there's a wide variety of causes. Anything from mechanical back pain, meaning a lack of sliding and gliding, to something more serious, like a disc herniation that causes nerve root compression and symptoms to radiate down your leg. Maybe something more chronic, to degenerative disc disease or arthritis of your low back. Because there's so many different causes and factors related to low back pain, the most important thing we do is a thorough evaluation. This includes a consultation where you come in, we get to know you better and understand the history of your back pain and any factors related to it. We then dive into an examination where we do orthopedic testing and ranges of motion that tell us exactly what tissue is inflamed, painful, or injured. We then do a spinal analysis. This looks at the sliding and gliding of your lumbar spine, pelvis, and sacrum. Restriction here can both cause pain or be locked up as a result of injury. Regardless, normalizing motion there can reduce pain and speed up healing. We lastly do a postural analysis and a movement screen. This allows us to identify any muscle imbalances you might have or faulty patterns of movement that might be overloading those tissues, causing them to be inflamed, painful, or injured to begin with. So once we've completed this process, we'll be able to tell you exactly what tissues are causing your pain and what factors are causing that pain to begin with. We can then create a care plan specific for you to get you out of pain quickly and to create resiliency in your low back, preventing future episodes. So what I want to do today is take you through our office and show you a little bit more about how we evaluate and treat low back pain. So our office has 9 different treatment rooms with 4 full-time doctors and 1 part-time doctor. We have a warm and inviting waiting room and check-in, check-out station where our admin will be able to greet you and move you through our office easily. What I want to show you next is the first treatment that we would do for low back pain is an adjustment. So the most common adjustment we do here is a diversified adjustment. This is one where you're going to hear cracking and popping noises, which is simply gas bubbles moving inside of the joint. We also have light force adjustment options, including activator adjusting, simple 𝒕𝒂𝒊𝒏 and glides, and flexion distraction where the table actually moves up and down. All of these adjustments are designed to normalize the sliding and gliding of the tissues in your low back, allowing you to get out of pain and allowing those tissues to heal faster. Once we've adjusted your low back, we do soft tissue. We know that those 2 therapies work extremely well together to get you out of pain and get you feeling better fast. So the soft tissue that we do, there's different types. We do trigger point therapy, where we simply put compression through a muscle and through a neuromuscular reflex, that tissue relaxes, to pin and stretch, where we pin the muscle and stretch it through its full range of motion. We also do Graston, where we use a metal tool to break up any myofascial adhesions. And we've recently added cupping, which what we can do while you're going through exercises and stretches to take tension out of that tissue in a functional way. So once we've got you feeling better with adjusting and soft tissue, we want to get you moving better with exercises. So for low back pain, the most common issue is a weak core or tight low back muscles and hip flexors. This often presents as lower cross syndrome. So we have exercise protocols for various different causes of low back pain that can be customized for you. But one of the most common exercises we do is a dead bug exercise to strengthen the core. And we focus a lot on hip flexor stretching to take pressure off of the low back and mobilize the hips. The last thing that we offer here at Brown Chiropractic are modalities. So these are electric stim, ultrasound, and laser. So electrical stimulation is when we send electric currents through the muscles to reduce pain in them or to reduce muscle spasm. Ultrasound sends sound waves into the tissues, increasing blood flow, reducing pain, and speeding up healing of that tissue. And laser shines a laser light on the tissue, which causes that tissue to duplicate or heal, and it reduces pain and inflammation in that process. So I hope you enjoyed your tour of Brown Chiropractic here and you understand a little bit more about how we evaluate and treat low back pain. Regardless of what's causing your low back pain, I'm certain we'll be able to identify the painful tissues as well as the factors related to it and be able to create a care plan to get you out of pain and feeling better quickly. My name is Dr. Andrew D. Bethune at Brown Chiropractic, and I hope to see you soon.